my name is Farah Khorassani. I'm a health sciences associate clinical professor at University of California, Irvine School of Pharmacy and Pharmaceutical Sciences. I'm also vice chair of revenue generating program development in the Department of Clinical Pharmacy Practice. So our poster is about a study that we did. So it was a retrospective observational study using a national, or actually it was a global cohort, using the Trinetic database. So what we did was, there's previous studies out there, secondary analyses and observational studies that suggest that there may be a better response to antidepressant treatment with noradrenergic or dopaminergic mechanism of action antidepressants. And so we thought, since a lot of these studies have patients on dual antidepressants, we could look at monotherapy. And so what we did was we designed this study comparing bupropion with any SSRI to see if there was difference in remission outcomes. So what we did was we looked at remission rates, we propensity score matched everybody based on 16 covariates and looked at those two cohorts. We had in each cohort about 165,000 patients, so a pretty large sample size there. And we did Kaplan-Meier analysis, we did relative risk to see if there was difference in remission. What we found was pretty interesting that overall remission rates were low. Our cohorts were actually a little bit different than what you would expect for your typical MDD population. The mean age was about 49 years old. It was mostly women, which that wasn't as surprising. But also, it was interesting that about 40% of them had a comorbid anxiety disorders. What we found was overall remission rates were very low. So like 8.5% in the bupropion group, slightly higher than what you would see in the other group, the SSRI group, which was a little bit less than 8%. So there was about a little bit less than a 1% difference between the two groups. In our Kaplan-Meier analysis, we found a statistically significant difference. It was minor, but we did see over time, about a 15% chance of remission in the bupropion group, which is kind of confirming what our previous studies showed. Same with the relative risk, our relative risk was about a 1.05. So it's about a 5% difference, chance of remission. So kind of what we take from this is that overall, people with MDD and obesity may be a little bit more difficult to treat based on those low remission rates. But obviously, we have to do future prospective studies just because this was observational, retrospective study relying on people to accurately code and completely code, which they don't always do with remission. So yeah, we were really excited to see this, but we look forward to seeing kind of future prospective studies.